Prolonged service time. Hello students, so we'll begin with our next topic in the evaluation and management, and that is prolonged service time. So let's begin with our presentation. In the prolonged service time, the first code which we are going to see is 99358 and 99359. Now this code must be used on the date other than the face-to-face E&M service with patient, family and caregiver. Then the second important point is must be related to face-to-face encounter as a part of ongoing patient management. As example is extensive record review. Code 99358 and 359 are used to report the total duration of the time and the date. It does not have to be continuous. Do not report prolonged service less than 30 minutes. Code 399358 is used to report the first hour and it can only be used once per date on any given day. Prolonged service of less than 15 minutes beyond the first hour or less than 15 minutes beyond the final 30 minutes are not reported separately. So these are the guidelines. So in short, when do we use the prolonged service? It is first of all not a face-to-face service and it is without direct patient contact. So in short, suppose you have a very difficult case where the patient has a syndrome or the cancer patient where which will require a lot of evaluation and lot of studies. So the doctor, after his regular hour, he can carry the file, home and study the patient file that okay, he has a cancer and then the cancer has spread to other thing. And suppose if he has some other chronic illnesses like the diabetes, how the management will be done for that patient. So the doctor is studying his file. So it is basically no face-to-face without direct patient contact, no patient contact on the date of service. So if he is studying the file, there is maybe usually the patient is not there because he is studying that file in the absence of the patient. So other than the face-to-face, but it has to be related to that patient because he cannot take any other file. He might end up taking the tax file of his and he will study, and if he asks for that money, then in the insurance will deny it. So it has to be related to the face-to-face encounter and it should be more than 30 minutes. So these are the two code 99358 and 99359 that we will use it for the prolonged evaluation and management service when there is no direct face-to-face contact with the patient. And let us see that 99358 is for the first hour and then 99359 it is for the each additional 30 minutes. Now remember, this is a very important note that do not report 99358 and 359 on the same date of service as of 99202, 203, 205, and there is a list of the code that has been given. Now if you see this particular code, these are the code for the office visit, and 99358 and 359 is a code for the prolonged service which doctor carries out when the patient is not there. So that also explains why we cannot write 358, 359 and 202 and 203 on the same date. Now let us look at this table. So remember, the first important note is less than 30 minutes. We do not report the prolonged service time code. And then this is a table. If it is 30 to 74 minutes, we will require 1 unit of 358. If it is 75 to 104 minutes, then we will require 1 unit of 358 and 1 unit of 359. So kindly go through this table and code it properly. Now let us look at the second code, that is 99415 and 416. These are the code for the prolonged clinical staff codes which are used for the E&M service provided in the office and the outpatient setting with the prolonged clinical staff face-to-face time. report in addition to the ENM service at the same session. So we will write the ENM code along with this code. Report the total duration of the face-to-face time with the patient and or family caregiver by the clinical staff. Can only be used for no more than two simultaneous patients. Can only be used for time devoted to a single patient. Do not use code 99415 if the time is less than 30 minutes. So, I mean, it is fairly clear by now that if the time is less than 30 minutes, we do not use the prolonged service time codes, because that is the same instruction was written in the previous for the previous codes also. And time spent performing a separate service does not count towards the prolonged service time. So remember, these are the code for the prolonged service of the clinical by the clinical staff with the physician or qualified healthcare professional supervision. Okay, so this is very important. So let us look at the code 99415 and 99416 and underline the important words. So first of all, make observation that 99415 it is a add-on code, and even the 99416 it is a add-on code. Now the prolonged clinical staff service, the service beyond the highest time in the range of total time of the service during an evaluation and management service in the office and or outpatient setting. Okay, and it is for the first hour. And remember, there is a very important note that use the 99415 in conjunction with this code. So whenever I am writing this code, I will write this any of this code prior to that. And this is the add-on code. So it will never be the first listed code. Prior to that, we will have the code. And 99416 is each additional 30 minutes. Last unit must be 15 or more to use 99416. Now there is a very important sentence here. The starting point for 99415 is 30 minutes beyond the typical clinical staff time. Now where is this typical clinical staff time? Because when you have seen the code for the outpatient office visit, for every code we have seen the time, but that is the time for the doctor. But there was no time given for the clinical staff, and here we are going to code for the prolonged service for the clinical staff. So where is this typical clinical staff time? Because to code that, it should be beyond 30 minutes. So let us see where to look for this clinical staff time. So where to look for the clinical staff time? Because all the codes which we have seen in the office visit, the every code had a time, but that time was the doctor's time. But there was no mention of the clinical staff time. So where do I look for that? So in your evaluation and management section, in the prolonged service time, you will see this table. And in that table, you have all the office visit new code and established patient code. And in front of that, there is a typical clinical staff time is given. And then 99415 time range, and then 99416 time range is given. So suppose in the encounter for the straightforward medical decision making, the clinical staff spent 65 minutes. Okay, so how will I write? I will write 99202 and 99415 because it was a 65 minute. So it is falling in this range, and so I will write. And remember, use 99415 in conjunction with 202 203 because we will have to write the office visit code also when I am writing 415, because we have seen that the 415 was an add-on code, and if you do not write this code, there won't be any meaning to that 415, because for which service you are writing, because 65 minutes for straightforward medical decision making, it comes here. But suppose if it was a high medical decision making for which the typical clinical staff time was 46, and if the if the clinical staff has given 65 minutes, then it is not a prolonged service time. So it is mandatory for you to write a 99415 in conjunction with the code that fits that encounter. Okay, very important. Now, the next is 99417 and 99418. 99417 is used to report a prolonged time spent by the doctor on the date of an outpatient visit, including office consultation, home visit, and cognitive assessment in the home or office visit. While the code 99418 is used to report the prolonged time provided by a physician or other qualified healthcare professional on the date of an inpatient evaluation and management service. So that is hospital inpatient or observation status visit, same day admission and discharge, consultation, nursing facility visit may only report this code if the time is documented for the encounter. Report 417 and 418 after 15 minutes has been exceeded. Do not report 417 and 418 with 358, 359 or 415 and 416. Why? Because these are the code that we use it whenever the patient wasn't there and the doctor was working on the patient file. These are the code for the staff and these are the code only for the doctor. So your book has done the excellent job of giving too many parenthetical notes. It is you that you have to read those notes. So the prolonged service with or without direct patient contact on the date of ENM. With or without direct patient contact means it could be on the floor somewhere. But the doctor is there and the patient is also there. Maybe not in the same room. That is very, very important. So these are the code 99417 and 418. So let us look at the important thing that you can use this code prolonged service outpatient. This is important because this is for the inpatient and that is for the outpatient, and this is for each 15 minutes of the total time. And again here important thing that use 99417 in conjunction with what are the codes what they have given, and do not report the 99417 in on the same date of service with the codes which they have given. So it is very important for you to read all these parenthetical notes so that you will never go wrong. And do not report another important thing 417 for any time unit less than 15 minutes. And now move to 418, that we can use 418 along with whatever the code, because this is the inpatient, this was the outpatient. Then again do not report 418 on the same date with psychotherapy codes, and do not report 418 for any time unit less than 15 minutes. So all these are very important parenthetical note. I would suggest that take a minute just to go through all this. I have given the important pointers here again, but all those pointers are covered in your parenthetical notes. Now, how will I report the prolonged service time? This is for the code 417 and 418. Here they have given the primary code. Here they have given the prolonged service code and total time to report the initial unit of the prolonged service and the total time to report the second unit of the prolonged service. So this is a very nice table that is given in your evaluation and management section. Kindly go through this table. So we will take one example for you to understand this table. So this is a chart in your book which talks about the total duration of the new patient office or other outpatient services, and they have used with the 99205 code. And here they have given the less than 75 minutes not reported separately. So let us assume that there is an encounter where there is a high medical decision making and the doctor has spent 70 minutes. So high medical decision making means 99205, because we have here that it is a high level of medical decision making, and 99205 code, and here you can see that for this particular code we have already the 60 minutes allotted and the doctor has spent 70 minutes. Does it come into this? No, because what is the chart says, less than 75 minutes not reported. So we will not report. But in case suppose the doctor has spent 85 minutes, then what? If the doctor has spent 85 minutes, then we come here and it falls into this range. So we will write 99205 and 99417. So you will write this code first followed by this. And again, pay attention that this is a add-on code. So you will have to have a code prior to this. And that's how you will write the prolonged service for the 99417 and 418 or the office visit. So let us have a final recap that we have seen three different types of prolonged service. First one was a prolonged service, no face-to-face, without direct patient contact, no patient contact on the date of service. This is basically without direct and face-to-face patient contact, used once per day on the day other than the face-to-face, must be related to the previous or in the future patient face-to-face as a part of the ongoing patient management. Then the second we have seen is the 415 and 416, that was for the clinical staff with face-to-face patient contact in the office, report in addition to the E&M service at the same session. So again the 415 and 416 we will write along with the E&M code because this is the clinical staff work. And then the prolonged service with a direct patient contact, we have the code 417 and 418. This code differs depending upon whether the service is outpatient or inpatient. With outpatient office, and 418 is non-direct inpatient, direct or non-direct inpatient consultation, same day A&D. So this is the snapshot of all the prolonged services, and kindly go through all the slides again. So let us take example so that we will find out whether your concepts have got clear or no. A physician is conducting a review of the medical records today for the patient who was seen in their office the previous week for a follow-up appointment. Although the previous visit was a low medical decision-making visit, the physician spent 1 hour and 15 minutes reviewing the patient's record, making notes and documenting the patient treatment plan. Because the patient seems to have an underlying autoimmune disorder associated with the patient thyroid, the doctor will consult with endocrinologist for the diagnosis confirmation of the following, which code best describe the encounter. Now let us see what is happening here. Physician is conducting a review of the medical record today for the patient who was seen in their office the previous week for a follow-up appointment. Okay, so this is very clear that today he is working on the patient file. Although the previous visit was a low MDM visit, the physician spent 1 hour and 15 minutes. Now the important thing is, I will give you the clue here, that we never write 99358 and 359 along with the office visit code. Why? Because these are the code we will write it when there is no patient, no face-to-face contact. So that is one important clue for you to eliminate the wrong option. So 99213 goes away because there is no patient. Then even 213 and 358 is not the correct code because we cannot write 213 code along with 358, and I can show you that parenthetical note also. So in between C and D we need to zero down our option. So yes, C is our correct answer. Here you can see prolonged evaluation and management service before and after patient care, first hour, and this is each additional 30 minutes. In our case it is 1 hour 15 minutes, and we have this table also where you can see very clearly 75 to 104 minutes, that is 1 hour 15 minutes. We write 99358 and 99359. And here it is a note, do not report 9935359 on the same date of service as this. So I cannot write this code and this code together. That also solves the mystery of why we are eliminating A and B. Let us take one example. Dr. Stein, a primary care physician, sees a 55-year-old patient with a chronic obstructive pulmonary disease in the office for a routine follow-up visit. The physician carries out a moderate exam with a moderate medical decision making. The physician determines that the patient needs a pulmonary function testing to evaluate their COPD. The physician orders the PFT and licensed practice nurse perform the test under the supervision of the physician. The licensed practice nurse performed the PFT and notes the result in the patient's chart. However, the patient had a difficulty during the test and then the nurse spent additional 95 minutes beyond the typical time with the patient. Of the following, which code best describe the encounter? Now, what is this? This is the case of the established patient because this is the case of the established patient because I can see the word follow up here. And then this is a moderate medical decision making, and who carried out the work, that is the clinical staff because the licensed practice nurse. So the clinical staff, and she carried out 95 minutes beyond the typical time. So we will have to now eliminate the option. So first of all, we this is the additional time. So we cannot write only the established office visit code. We will have to write and prolonged service time, and this prolonged service is given by the clinical staff. Now 99415 and 416, these both are the add-on code. So we cannot just write them. There will be a code prior to this. So C and D is not the correct option. Now in between A and B, we need to finalize our option. And for that, we are going to consider the additional 95 minutes beyond the typical time with the patient. Okay. So yes, B is the correct answer because the nurse has spent additional 95 minutes beyond the typical time with the patient, and so we have the code here 99415, which takes care of the first 1 hour, and the remaining 35 minutes for which we will take 99416. This is very, that's for additional 30 minutes. Okay, so B is the answer. So let us take the question. Mrs. Donaldson is an 85-year-old female who has been experiencing a memory loss and confusion for several months. Her family noticed a decline in her daily function and were referred to Dr. Smith, who's a neurologist, for evaluation and management of her condition. During her visit, the provider conducted a comprehensive medical history and physical examination, paying close attention to her neurological function and cognitive abilities. The examination was accompanied by a high medical decision making, and then Dr. Smith diagnosed Mrs. Donaldson with dementia and wrote a prescription for donepezil to improve her cognitive function. Dr. Smith spent time talking to Mrs. Donaldson and her family about her diagnosis and the progression of the disease and the available treatment option. The importance of maintaining a healthy lifestyle, including the balanced diet, regular exercise, and social engagement, was emphasized to slow down the progression of the disease. The physician spent total 120 minutes during the encounter of the following, which best describe the encounter. And let us see what are our options. So if you see the option, there is the new patient new patient office visit option, and then there is a one code which is for the consultation. So first of all, we will find out that which code is right. Now, is this the case of consultation? How do I find out that? So here, her family noticed a decline in her daily function and were referred to Dr. Smith. So who was went to Dr. Smith? The family went on their own. They were not referred to Dr. Smith by any doctor. So this is not the case of consultation. So the option C goes away. Now we have A, B and D. So we will require a high medical decision making code because this is now the office visit, new patient, because This doctor is seeing the patient for the first time and the MDM is high. So we will definitely require 99205. Now 99417. What is the total time of 120 minutes? So definitely this is the prolonged time, because if you remember the code 99205 and if you remember the time for the 99205, it is 60 minutes, and here the doctor has spent 120 minutes. So that means the doctor has spent 60 minutes more with the patient beyond actual time. So now we have enough data to zero down our answer. So 99205 is also not correct because it will require a prolonged service time code. Now in between B and D, what is our correct answer? So after collecting the data, we have reached the answer 99205, and we will require 4 units of 99417 because this is additionally 60 minutes. Okay, whenever we have been given a total time, we have to add code time plus additional time is equal to total time. So code time 9920560. So we will be calculating for additional 60 minutes. Okay, remember that. And since 417 calculate 15 minutes is equal to 1 unit, here we will require 4 units of that. Let us take one more question. 55-year-old female was admitted after radical mastectomy with an invasive ductal carcinoma of the right breast. TRAM reconstruction could not be performed because of the intraoperative pathological result came back positive for malignancies in the lower abdominal tissue. Because the pathologist could not confirm the origin, the oncologist requested a consultation with Dr. Mayer and OBGYN to rule out the malignancies of the female genital system. Dr. Mayer carried out a comprehensive medical history and conducted a thorough gynecological physical examination, paying a special attention to the vagina, uterus, cervix, and ovaries. The consultant ordered CT scan, ultrasound, MRI, PET scan, read the result, and then recommended the patient have a colposcopy with a biopsy before offering a confirmatory diagnosis. The encounter produced a high MDM. The consultant spent total 120 minutes of the total time in the encounter with the patient and family, who had a several questions about the patient's outlook in terms of the breast cancer and probable cancer of the female genital system. The consultant reported his finding via written correspondence back to the patient oncologist of the following, which best describe the consultant. Now let us get our data. Now, is this a case of consultation or no? Yes, Dr. Mayan and OBGYN was consulted. Now, whether the consultation has complete, Dr. Mayer carried out all the diagnosis and then the treatment. He did a high MDM and then reported his finding via written correspondence back to the patient oncologist. So the consultation has happened. But where did it happen? Because if you see the option, we have one option for the outpatient consultation, we have one option for the inpatient consultation. So let us see whether it is a inpatient and outpatient. So if you see the first, the line, it says was admitted. That means it was a inpatient hospital. Admission happens only in the hospital unless they have written observation status. So it is a inpatient. Now we will, so inpatient, that means 99245 is not the correct code, and 99205 is also not the correct code because it is the code for the office visit of the new patient, and this is the case of consultation. So we have left with option D and option A. Now we know that this is an inpatient consultation. That also will give us a clue whether can we write 417 or 418. So let us see our answer. So option A is the correct answer. 99255 is the inpatient consultation, and that particular code requires 80 minutes. Our doctor has spent total of 120 minutes. That means how many more minutes extra? He has spent 40 minutes extra. Now let us take this, that how many units we will require. 15 minutes is equal to 1 unit, and we will require a additional 15 minutes unit also, because here it is a additional 40 minutes the doctor has spent. uh, Remember that this is a total time, and when we consider the total time, it is always the basic code time plus the prolonged time. And in this case the basic code time is 80 minutes, so additional 40 minutes extra, and for that we use the 418. So this is my last slide for the prolonged service, and we have now the preventive care and the nursing facility that we will do in the next session.